So in 1967, an eager supporter of federally funded family planning wrote to Congress and said, quote, "No American woman should be denied access to family planning assistance because of her economic condition." And that supporter was President Richard Nixon. And the next year, the Title X family planning program was finally enacted into law with broad support. Co-sponsors of the legislation that established the program included several Republican members, including then Congressman George H.W. Bush. And at the time, there was an understanding on both sides of the aisle that many Americans, and especially low-income women, were having more unintended pregnancies than they wanted. And both Democrats and Republicans understood that the primary driver of this phenomenon was inequitable access to contraception and reproductive health services. Researchers suggest that unintended childbearing increases poverty, limits education, reduces women's ability to participate in the workforce, and was an overall detriment to the health of women and girls. And so, the United States listened to the experts, considered the facts, followed the science, and established Title X. And almost 50 years later, what we are looking at is the Trump administration deciding to turn back the clock and really, in many ways, decimate for many people the robust network of family planning providers across every state. So far, still Missouri has availability of full range of reproductive health in our nation. So I think this is all about abortion. The name of the bill that the rule that was passed, what is it, Protect Life? Something like that. This is about abortion. This is about trying to limit women from having their full reproductive rights. Because what doctors then have the option of is either withholding critical information and limiting care to their patients, leaving the program and scaling back clinic services, laying off staff, or closing their doors due to the limited resources. And all of these options are completely unacceptable. The chairwoman of the subcommittee listed all of the groups, literally all of the health provider groups that oppose this rule, and have written very carefully what they said. 19 leading women's health care provider groups, medical organizations, and physician leaders have stated, and here's a quote, "This regulation will do indelible harm to the health of Americans and to relations between patients and their physicians by forcing providers to omit critical information about health care and resources available. The final regulation directly undermines patient confidence in their care. There is no room for politics in the exam room." This is the politics of abortion that we're dealing with right now. And I want to just state, for the record, women are not going back. Women are not going back. This is not going to be tolerated right now. And what I don't understand, are you saying that any clinic now that provides comprehensive health care, comprehensive scientific health care, can no longer locate with any clinic that itself separately provides abortion?
Yes, that is what the new rule states.
So the many, I don't know what the number is, but the many clinics that do provide the whole range of health care, those clinics, some that are the only provider in a community, will have to somehow change their way of functioning entirely. Do you not think that's going to be a difficult process?
Again, it is not, whether or not it is going to be difficult, that is not the issue that this regulation is addressing. It is addressing the fact that the statute says that these funds may not be used in a program where abortion is a method of family planning. And that, again, has been part of the statute since it was developed.
This is not going to stand, and women around this nation are not going to tolerate that. Thank you. I yield.
I would just point out that's not what the statute says. We can get to that later.